Well, apparently, on the last time I talked, I made people weep, so I'm not going to do that again, I promise. A little bit about myself, because there's some people here that weren't here the last time I spoke. I've been a chiropractor for, I don't know, about, let's see, 2003, so 13 years. I've had an office of my own. I've worked as an associate and, you know, have done tens of thousands of adjustments over the years. What I want to talk to you guys today is a little bit about chiropractic in general. Okay, I was a little bit more specific last time. Let me ask you a question. If we had a world of people less medicated, more vibrant, more alive, wouldn't that make the world a greater place? Yes or yes? Yes. So I'm going to start off with the end in mind. As I said in my commercial, if you're breathing, then you have a spine. Even you, John. If you have a spine, it needs to be checked. It's just that simple. How many people here see a chiropractor on a regular basis? What?
Every Thursday.
How many people get checked by a chiropractor on a regular basis? All right, nice.
Well, that
Good
changed
job,
the
Ted.
number a lot.
How many people have ever seen a chiropractor or been checked by a chiropractor? Okay, a lot more, right? Chiropractic is good at best at being reactive. Chiropractic is best at being proactive. Okay? Reactive, that's the medical model, that's the medical world. That's take a pill, inside, outside in, have something happen to you. Proactive is being proactive in your health. Alright? I'm just like all of you. Alright? We're all the same, believe it or not. We all want to feed, we all feed the community, right? We all feed the community in order to feed our family, right? We all do what we have to do. Some of us may be printers, mortgage bankers, insurance agents. We all want to be good, right? We all want to be good for the community. We all just want to be good gals and good guys. Sure, we all want to obliterate debt. We want to accumulate wealth. We want to put food on the table. No matter what the difference of our vocation may be, our intentions are the same. Our intentions are the same. We want to be good. We want to be good for our community. We want to be good for our family. We want to be good for the world. Normally, I want to learn all about what you guys are about. But this is my time to talk about what I'm about. And isn't it great that we can fellowship among ourselves, like-minded people, and meet like this weekly? Isn't it awesome? It's pretty awesome. So I'm a chiropractor. What do we do? As a chiropractor, I just want you to know, I don't treat anything. Pretty surprising, right? Because normally a doctor would say, well, I treat this, or I treat that. I don't treat anything. Really. Sure, you hear we can help people with headaches, back pain, help the little ones with ear infections, Grandma Jenny or Grandpa Joe with that hip problem. What our best, my best reputation is by helping people get well the fastest. Okay? If you look at an Illinois Blue Cross Blue Shield study, it's from like around 2014, so relatively recent. And I mean, this is a huge study. They took 70,000 participants. Chiropractic could save Americans nearly $200 billion a year if they use it the way that they should. Proactive versus reactive. Chiropractic means without drugs, hands-on. The best of chiropractors will give you plans for care, okay? Not just give you an adjustment for back pain relief and say, come on in when it hurts again. That's reactive. I'm talking about being proactive, right? The dentist, for example, will say, hey, come, you have to get your teeth checked once every 6 months, right? It's the difference in the spine. You don't see it, right? You don't feel it. It would be stupid for a dentist to say, well, when your teeth are rotting and your gums are bleeding, come on in, let's take care of it. That would be kind of bad, right? My joy comes from knowing I help people express themselves ideally. Not just getting them out of pain, not just help express themselves to the fullest that they possibly can. From inside out, right? From inside out, not outside in. That's the greatest joy that I have. All right, so let me tie this together a little bit. Anybody know the leading cause of death according to Duke study? Google it. That was done, I think, probably in the mid-2000 range, before 2010.
Yeah.
Cardiac, heart disease. No, Google it. Duke study. Leading cause of death. You want to know what it is?
Diabetes.
Stupid people!
That's what it says.
I'm serious. It's people making dumb choices for what they do to their bodies and to their cells. It's right there. Duke did a study on it. Meaning most diseases are preventable if you are proactive in what you do to your body. And one of the best things you can do to your body is make sure that your nervous system is functioning the way that it should, because our nervous system controls what in our body, folks?
Everything.
Everything. Your spine houses the nervous system, right? Brain and spinal cord is your nervous system, and all the nerves that go to your organs, your blood vessels, your kidneys, your fingertips, everything. So if there is a blockage on that nervous system, who is there to check it? Who checks it? Not your dentist. No, sorry. Not your MD, not your medical doctor, not your GP. A chiropractor checks it. So if the nervous system is the most important system in the body, the thing that controls everything in the body, why wouldn't you just get checked? Just get checked. That's it. So my call to action. If you're breathing, if you have a spine, you need to be checked. And trust me, here's the thing. Because sick posture means a sick human being. Rest assured, if you did come to me to get checked, and of course I'm going to say come to me to get checked, right? I will do nothing to try to make you a patient. Sounds kind of counterproductive, right? I will do absolutely nothing to make you a patient. But I will engage you in becoming more intelligent. Thank you.
Yeah.